Today I'm going to be talking about the use of Tylenol in children. Tylenol, which is also known as acetaminophen, is a medicine that is safe to use, and indications include pain and fever control. In most cases, there's a recommended dose based on your baby's weight and age. So it's very important that you follow those recommended doses. Sometimes it's said on the bottle for older than 2 years old, but if they're younger, then please check with your pediatrician to know how much Tylenol to give your baby. However, there's a few times when Tylenol could be dangerous to your child. One of them is if they get too much Tylenol. Too much Tylenol at one time is considered toxic, so it could hurt many organs. But one of the organs that it affects is the liver. Sometimes we commit what's called unintentional overdose, and those we have to be careful. So how do these occur and how to prevent them? Sometimes you're trying to help the situation, but in reality it might be more dangerous. You're like, well, that one dose didn't work, so let me give him a little more to bring the fever down even more. So giving him higher doses or her higher doses than is recommended. Sometimes a combination of other drugs, and unfortunately we've seen this where you're giving Tylenol for fevers, and you're probably giving it just like the bottle says, every 4 to 6 hours. But then they also have a cold, and you buy some NyQuil, Benadryl, and some of those medications you have to read carefully also have Tylenol. So you're giving Tylenol for the fever, and you're giving a medication that also has Tylenol in it that you weren't aware. So when you combine the 2 doses of Tylenol, you're giving too much for the weight of your child. So what are the symptoms of Tylenol overdose? And that's hard because in the first day, there's not a lot of symptoms. It usually happens over the next 2 to 4 days. But at first, your child might just feel tired, some belly aches, or just some nausea. And then over the next few days, as the injury to the liver and other organs occur, then the baby or your child might appear yellow, confused, just sort of out of it. So if there's any concern that there's been an unintentional overdose of Tylenol, please make sure you seek medical attention quickly. And the reason I say this is because we have an antidote for overdose, but it has to be given in a timely manner shortly after the ingestion.